Pantoprazole is a proton pump inhibitor used to treat erosive esophagitis, gastric acid hypersecretion, and to promote healing of tissue damage caused by gastric acid. In this video, let's find. What is pantoprazole? What is pantoprazole used for? Contraindication. What side effects of taking pantoprazole? How does pantoprazole work? How to use pantoprazole? What is pantoprazole? Pantoprazole, sold under the brand name Protonix, among others, is a proton pump inhibitor used for the treatment of stomach ulcers, short-term treatment of erosive esophagitis due to gastroesophageal reflux disease, GERD, maintenance of healing of erosive esophagitis, and pathological hypersecretions including Zollinger, Ellison syndrome. It may also be used along with other medications to eliminate Helicobacter pylori. Study of pantoprazole began in 1985, and it came into medical use in Germany in 1994. It is available as a generic medication. In 2020, it was the 20th most commonly prescribed medication in the United States, with more than 26 million prescriptions. What is pantoprazole used for? Pantoprazole injection. Treatment of gastroesophageal reflux disease associated with a history of erosive esophagitis. Pantoprazole for injection is indicated for short-term treatment, 7 to 10 days, of patients having gastroesophageal reflux disease, GERD, with history of erosive esophagitis, as an alternative to oral medication in patients who are unable to continue taking pantoprazole delayed-release tablets. Safety and efficacy of pantoprazole injection as the initial treatment of patients having GERD with a history of erosive esophagitis have not been demonstrated at this time. Pathological secretion associated with Zollinger-Ellison syndrome. Pantoprazole for injection is indicated for the treatment of pathological hypersecretory conditions associated with Zollinger-Ellison syndrome or other neoplastic conditions. Pantoprazole, delayed-release oral suspension. Short-term treatment of erosive esophagitis associated with gastroesophageal reflux disease, GERD. Indicated in adults and pediatric patients 5 years of age and above for the short-term treatment, up to 8 weeks, in the healing and symptomatic relief of erosive esophagitis. For adult patients who have not healed after 8 weeks of treatment, an additional 8-week course of pantoprazole may be considered. Safety of treatment beyond 8 weeks in pediatric patients has not been determined. Maintenance of healing of erosive esophagitis. Indicated for maintenance of healing of erosive esophagitis and reduction in relapse rates of daytime and nighttime heartburn symptoms in adult patients with GERD. Pathological hypersecretory conditions including Zollinger-Ellison syndrome. Indicated for the long-term treatment of the above conditions. Contraindication. Pantoprazole is contraindicated in patients with a history of hypersensitivity to the drug itself, components of the formulation, and/or other benzimidazole PPIs, including omeprazole, lansoprazole, rabeprazole, esomeprazole, or dexlansoprazole. Side effects. The more common side effects that can occur with pantoprazole include headache, diarrhea, stomach pain, nausea or vomiting, gas, dizziness, joint pain. Pharmacodynamic. This drug acts to decrease gastric acid secretion, which reduces stomach acidity. Pantoprazole administration leads to long-lasting inhibition of gastric acid secretion. General effects. Pantoprazole has been shown to reduce acid reflux-related symptoms, inflammation of the esophagus, and improve patient quality of life more effectively than histamine 2 receptor antagonists, H2 blockers. This drug has an excellent safety profile and a low incidence of drug interactions. It can be used safely in various high-risk patient populations, including the elderly with renal failure or moderate hepatic dysfunction. Due to their good safety profile and as several PPIs are available over the counter without a prescription, their current use in North America is widespread. Long-term use of PPIs such as pantoprazole have been associated with possible adverse effects, however, including increased susceptibility to bacterial infections, including gastrointestinal C. difficile, reduced absorption of micronutrients including iron and B12, and an increased risk of developing hypomagnesemia and hypocalcemia, which may contribute to osteoporosis and bone fractures later in life. PPIs such as pantoprazole have also been shown to inhibit the activity of dimethylarginine dimethylaminohydrolase, DDAH, an enzyme necessary for cardiovascular health. DDAH inhibition causes a consequent accumulation of the nitric oxide synthase inhibitor asymmetric dimethylarginine, ADMA, which is thought to cause the association of PPIs with increased risk of cardiovascular events in patients with unstable coronary syndromes. Mechanism of action. Hydrochloric acid, HCl, secretion into the gastric lumen is a process regulated mainly by the H+/K+ ADPase of the proton pump, expressed in high quantities by the parietal cells of the stomach. ADPase is an enzyme on the parietal cell membrane that facilitates hydrogen and potassium exchange through the cell, which normally results in the extrusion of potassium and formation of HCl, gastric acid. Proton pump inhibitors such as pantoprazole are substituted benzimidazole derivatives, weak bases, which accumulate in the acidic space of the parietal cell before being bid in the canaliculi, small canal, of the gastric parietal cell, an acidic environment, to active sulfenamide derivatives. This active form then makes disulfide bonds with important cysteines on the gastric acid pump, inhibiting its function. Specifically, pantoprazole binds to the sulfhydryl group of H+, ADPase, which is an enzyme implicated in accelerating the final step in the acid secretion pathway. The enzyme is inactivated, inhibiting gastric acid secretion. 7 The inhibition of gastric acid secretion is stronger with proton pump inhibitors such as pantoprazole and lasts longer than with the H2 antagonists. Half-life: about 1 hour. Dose: erosive esophagitis associated with GERD. Treatment: 40 mg POQ day for 8 to 16 weeks. Maintenance of healing: 40 mg POQ day. Alternatively, 40 mg 4Q day for 7 to 10 days. Short treatment of GERD: oral therapy inappropriate or not possible. 40 mg 4 infusion over 15 minutes Q day for 7 to 10 days. Switch to PO once patient able to swallow. Zollinger Ellison syndrome: 40 mg POQ day, up to 240 mg per day administered in patients. 80 mg 4 infusion Q8-12HR up to 7 days. Switch to PO once patient able to swallow. Peptic ulcer disease, off-label. Duodenal ulcer, 40 mg POQ day for 2 weeks. Gastric ulcer, 40 mg POQ day for 4 weeks. Safety advice: pantoprazole is classified as pregnancy category B, and there are no well-controlled studies in pregnant women. While pantoprazole and its metabolites are excreted in the milk of rats, it is not known whether they are excreted in human milk. That's all the information about pantoprazole we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.